Hello, my name is Cynthia Koo, and I am a regional anesthesiologist and member of the Division of Global Anesthesia at Stanford Hospital. This lecture will focus on the femoral nerve block. This case is based on several I saw while in Rwanda at Shiashika, the public hospital in Kigali. This 32-year-old male had a femoral neck fracture after a motorcycle accident. In many parts of the world, hip fractures are a result of osteoporosis. The highest rates are seen in the United States and Northern Europe, while the lowest hip fracture rates are seen in Latin America and Africa. In the US, there are 300,000 hip fractures per year. 95% occur from falls, and the 30-day mortality is approximately 5%. In our setting, we have a protocol where an orthopedist, internist, and anesthesiologist see the patient in the emergency room to evaluate for surgical fixation and to place a femoral nerve block for pain relief to reduce opiate requirements and side effects in our elderly patients who are prone to delirium. The learning objectives for this lecture include femoral nerve anatomy and the indication, risks, and tips for placement of a femoral nerve block. The femoral nerve block causes numbness of the anterior and medial thigh and a stripe of the medial leg from the knee down to the ankle. The femoral nerve block can provide analgesia for hip fractures, as well as surgeries of the femur, patella, quadriceps tendon, and the knee. Here we have an image of the lumbar plexus. The femoral nerve, highlighted with the red arrow, is the main nerve innervating the anterior thigh. It originates from L2, 3, and 4 and is the largest component of the lumbar plexus. The lateral femoral cutaneous nerve, highlighted in orange, innervates the skin of the lateral thigh, whereas the obturator nerve, highlighted in green, innervates the medial thigh. The sciatic nerve, with the blue arrow, innervates the posterior thigh and originates from the sacral plexus. The femoral nerve travels through the psoas muscle and exits as it crosses under the inguinal ligament. At the level of the inguinal ligament, which is shown on the left, the femoral nerve travels lateral to the femoral artery and vein. In the right lower image, the femoral triangle is the area below the inguinal ligament. It's bordered by the sartorius muscle and the adductor longus muscle. At this level, the femoral nerve gives off articular branches to the hip and knee joints. About 4 centimeters into the thigh, the femoral nerve splits into the anterior and posterior divisions. The terminal cutaneous branch of the femoral nerve is the saphenous nerve, which travels through the adductor canal with the femoral artery and vein. The motor innervations, which is shown here in red, include the nerves to the iliacus and the pectineus, and the nerve to the sartorius, which comes off of the anterior division, and the nerves to the quadriceps muscles, which come off the posterior division. The sensory innervation, shown in green, includes innervation to the anterior and medial thigh off the anterior division, and innervation to the saphenous nerve from the posterior division. The femoral nerve also innervates the hip and knee joints. The hip joint is innervated off the nerve to the rectus femoris, whereas the knee joint is innervated by the nerves to the vastus, particularly the vastus medialis. For ultrasound visualization of the femoral nerve, the transducer is placed in the femoral crease along the inguinal ligament. The nerve appears lateral to the femoral artery below the fascia lata and fascia iliaca. The nerve lies above the iliopsoas muscle. Prior to ultrasound, the block would involve feeling the pulse below the inguinal ligament and advancing the needle 1 to 2 centimeters lateral to the pulse until you felt 2 pops through the fascial layers, and the nerve stimulation would result in a quadriceps twitch. At the level of the inguinal ligament, the femoral artery splits into the superficial femoral and profunda femoris, as shown in this left image. The superficial femoral artery becomes the popliteal artery, whereas the profunda femoris travels laterally and branches early to supply the thigh. The ultrasound probe is moved towards the head, or cephalad, until one femoral artery is seen, as shown in this right image. The nerve will be lateral to the artery below the fascia lata and iliaca, and a slight tilt of the ultrasound probe can highlight the nerve. The block indications include anterior thigh, femur, and knee surgery. If the patient is able to, the leg should be externally rotated. Often in hip fractures, the leg is already externally rotated. The probe can be placed along the femoral crease lateral to the femoral artery, and the nerve is found below the two fascial layers. The needle can then be passed from lateral to medial in plane, either above or below the femoral nerve, and 10 to 20 mL of local anesthetic is injected. Because the nerve will impact quadriceps muscle strength, the patient will be at increased risk of falls. Other complications include possible nerve or vascular injury. The next 3 images are from our patients. See if you can identify the key structures. Note that there is a slight variation in appearance, but the femoral nerve is found consistently lateral to the femoral artery between the fascia iliaca and the iliopsoas muscle. Tilting the probe will make the nerve appear more clearly. Compressing the tissues with the ultrasound transducer is another way of making the nerves appear more clearly, especially in patients where the structures are deeper, such as in this example. The ultrasound can also be used for femoral central line placement or femoral arterial line placement. Note that the artery has a thicker wall, whereas the vein is compressible. Typically for line placement, the needle is inserted out of plane, whereas for nerve block placement, the needle is inserted in the plane of the ultrasound image. This question tests your understanding of the femoral nerve anatomy. Each of the following statements is true concerning the femoral nerve block except A. The femoral nerve primarily arises from the second to the fourth lumbar nerve roots. B. The femoral nerve provides sensation to the anterior and medial aspects of the thigh. C. The femoral nerve lies lateral to the femoral artery and femoral vein. Or D. Proper needle placement produces sartorius muscle contraction without patellar movement when electrically stimulated. The correct answer is D, because the femoral nerve divides into the anterior and posterior divisions. The anterior provides motor innervation to the sartorius muscle and cutaneous innervation to the anterior and medial thigh, whereas the posterior division innervates the quadriceps muscle and provides cutaneous innervation to the knee and knee joint from the saphenous nerve. If the stimulation is causing sartorius contraction without patellar movement, then the needle is too anterior and needs to be redirected deeper. In summary, the femoral nerve supplies the anterior medial leg and branches into the anterior division, which supplies the sartorius, and the posterior division, which supplies the quadriceps muscle. The nerve lies lateral to the femoral artery and vein, below the fascia lata and iliaca, and above the iliopsoas muscle. A femoral nerve block can be used to reduce pain from hip or knee surgery. For more information, please check out these references.